What are the factors that actually play into recovery from after having an injury?
You have to be very careful because sometimes people don't really want to buy into it. It's hard telling someone that they need to make a lifestyle change.
What stops people from progressing?
How fear impacts their recovery and how stress impacts their recovery. We talked about the difference between rest and sleep. Again, rest, we're just slowing things down. We're not getting that blood flow that we need. But again, sleep, we want to make sure we're getting sleep.
Welcome to the Healthcare Revolution podcast. Today we have a very fun topic from an absolute expert in this area about why people recover quickly after an injury and why people take longer. You know, this is a really big problem, and a lot of people think, is it my age? Is it my genetics? Is it the way I'm sleeping? What are the factors that actually play into recovery from after having an injury? So we're going to dive into all things on that topic. And I'll introduce our speaker here in a minute. But the topic is why some people recover quickly and why some people stay stuck. It's a really cool topic because not everyone heals at the same rate. There are different factors that you can implement into your practice to be able to heal and recover quicker. And we're going to give all those tips today. So, like I said, many people deal with this. Some people do it fast, some people do it slow. But by the end of the episode, these are the things that we hope that you take away. The real reasons why two people with the same injury recover completely different speeds. We hope that really helps you. And then the everyday habits that quietly delay healing. That's really important. What are you doing every single day to influence that, and how do you stop them? And then why movement and mindset matter as much as the injury itself. Super crucial. I've realized this myself, breaking over 34 bones in my life and going through a lot of rehab. There's so much more than just the healing of the injury. What you do with your mind and what you tell yourself and the movement that we're doing every day really does matter. And then two more, how to tell the difference between what's hurt and what's harm and deciding when to push through it or getting help. And then the last one is practical steps to give yourself the best possible shot at quickly recovering. So those are the things that we hope you take away from this episode. Those are the things that we're going to cover. So today I'm joined by Brent Losee. He is a doctor of physical therapy here in South Jordan, Utah. He's our clinic director. He is leading a group of physical therapists here in the South Jordan area. Best of Salt Lake City. Best of state. We just won best of state this year in physical therapy. So super thrilled to be able to have him on the podcast. Brent, welcome to the podcast.
Thanks for the invite. Excited to be here.
We're excited to talk about this area of your expertise. You've been treating thousands of patients the last 8 years, everything from post-op rehab to sport, return to sport, post-pregnancy, postpartum, really all a huge variety. You've had such a big practice, not like a specific niche, but very, very broad, and had a ton of experience and a ton of insight that you're going to bring into this. So talk to us about, where did all of that start in wanting to be kind of a broad, more general specialist in musculoskeletal?
Oh, man. I would say, going back to like kind of why I even wanted to be a physical therapist in the first place, I always wanted to do something in healthcare. I realized very soon or very quickly into my collegiate career, I do not do well with blood. And so I figured like physical therapy.
It's a good in between.
Exercise is a little safer. We don't have to deal with a lot of blood. That's always gets me a little queasy. But
yeah, I'm very different, Brent. I think I should have been a trauma surgeon. Although the reason I'm not a trauma surgeon is the lifestyle of a trauma surgeon is really terrible. And I love the blood. It's a good time.
Oh man, not for me. Like
anything I got to triage blood wise, let's make it happen.
See, even like the surgical videos, like I can't do it. So, but I always like the idea with physical therapy of like exercise being a form of treatment. I've always enjoyed exercising, working out. I did track and cross country in high school, and that was always something that I enjoyed. And so finding ways to like help people get better through movement, through hands-on stuff, like I feel like that's kind of what I've really enjoyed, or what I've actually really like found my niche in that regard. So I do tend to treat more of a broad base. I don't feel like I really specialize in anything in particular, because I think there's like so many different like areas that you can kind of get caught up in, and I want to see it all. I want to work with everyone.
I hope that you really understand this principle, and that is that exercise, if well understood, is the best medicine in the entire world.
Yeah.
There's no better medicine. If you really look at the logistics of exercise and appropriate exercise, appropriate dosage, it is literally the best medicine in the world. If everyone truly understand that, it would be the most prescribed medication on the market, because it has more effects than any other medication, and it has no negative side effects.
Yeah.
It's all positive.
And then it makes me wonder why that isn't something that regular doctors just don't prescribe. Maybe that's not something that should happen. Maybe that's part of this.
And it is challenging, right? Primary care physicians have a challenging job. They're going through multiple systems, having multiple conversations, figuring out where people are. They're looking at motivational interviewing, like, where do I even start? I got 15 minutes. I got to get to my next patient. You as a physical therapist, we as physical therapists are on the front lines to be able to have that conversation. So really, we need to make that shift to everyone needs a primary care physical therapist in their life, because as you know, the exercise conversation is very customized.
Yeah. And you have to be very careful, because sometimes people don't really want to buy into it. And then also I feel like it's hard telling someone that they need to make a lifestyle change. Some people don't like that. Some people don't want to hear that. And so it is kind of, you have to be a little bit systematic in your approach. You have to be sometimes a little tricky, but
and it's so fun to talk to a patient and ask them, like, what are the things that are limiting you in life? What is that limiting factor that you really want in your life? And what's limiting your ability to do it? Well, I can't kneel on the ground. Okay, let's break down why you can't kneel on the ground. And we go through that, and maybe it's knee range of motion. Okay, let's work on your knee range of motion. Maybe it's quad strength to be able to lower your body. And then we start to unpack this, and all of a sudden we start to figure out, tell me what your exercise routine looks like to be able to maintain your quad strength, right? This is the motivational interviewing techniques that we use, because ultimately we can't just impose upon these patients what we believe needs to happen, these lifestyle changes, right? What we need to do is help them see how it's actually going to give them a better quality, and then they motivate themselves.
Yeah. We can try to impose all we want, but if they don't want to do it, they're not going to do it.
Yeah. But when we help them see how the lifestyle change is in congruence with what they want to be able to kneel on the ground, if I want to be able to kneel on the ground, I need to exercise, right? I don't have the quad strength, therefore I need to strengthen my quads, right? Those thigh muscles. And that's what lowers myself to the ground. So if I'm not regularly exercising, I'm not going to be able to kneel. And kneeling's important to me, And maybe it's to kneel down with the grandkids to play. Maybe it's to be able to pick things up off the ground. Maybe it's to be able to feed your cat. Like, there's so many different reasons to be able to do those activities. But I love taking motivational interviewing techniques and helping people really see why it's important for them to exercise. So, but I completely agree with you. But I really hope over time we all develop a primary care physical therapist that can help us customize our exercise experience, because primary care physicians are not centered well to be able to help people with exercise. We can just give a slip, they can give a slip all they want. But as far as like creating real change with people, it starts intrinsically. And that's what physical therapists are trained well at, is helping people identify the intrinsic motivation to be able to help themselves. So let's jump into our topic of why people get stuck. You got two people that have the same injury, the same age, maybe even same genetics. Let's talk about like what really, like, when you're in those situations, what stops people from progressing? What are things that come to mind?
Some of the main things that I have seen, especially working with, again, because I feel like I've seen a lot of, for example, total knee replacements or like rotator cuff repairs. like there are some cases where, yeah, you need to take it a little bit easier and have to go into it a little bit slower. But I think a big part of it is, what is their mindset? Do they how do they want to push themselves, or do they really want to get back to doing X, Y, or Z, or are they afraid of getting back into doing X, Y, or Z? And so I think it's one of those things where we have to find out what is their emotional button, what do they like you were talking about, what really motivates them. And that's what makes it a little bit tricky for us, is trying to figure out, okay, what's going to help this person over this person, and how can we basically get everyone back to where they want to be.
Yeah.
I think so mindset's going to be one.
Let's talk about mindset for a minute. I think this is really important, because this is not just like a positive mental attitude. I heard a quote once that said, really, life is 80% mindset and 20% mechanics, right? And I took it a little out of context. They said business is 80% mindset and 20% mechanics. But I think that can translate with anything in life. It's really how you're thinking through the process that makes the big difference. If you have an internal belief that you can heal quickly, if you have an internal belief that you can overcome hard things, let's break this down more. What does mindset really mean to you?
There's a couple things I wonder if you read that study about it was cancer cells. Did you hear about this one? So I feel like this is kind of an interesting example, but when people are going through chemo or when they're going through radiation, what they were encouraging their patients to do was actually imagine or visualize those cancer cells being directly influenced or directly attacked by the treatment that they were taking. And they actually saw that there was and I wish I could remember the statistic exactly, but they actually saw that just having that mindset or having that idea that the medication was doing its job actually made the medication do its job.
Visualization.
It was crazy.
Yeah.
And then then I think okay, similar kind of aspect or similar concept when we're working with our patients. I think if they think the exercise is going to be helpful for them, if they're okay, hey, actually I feel good. And if they get it in that mindset that this is going to make them better, then why wouldn't it make them get better?
Yeah. I had my own case study of that. I used to race motocross, and I was hurt a lot, as we talked about earlier. I broke a lot of bones. But my friends would give me a hard time because when I would break bones, I would play this video game. It was called ATV Off-Road Fury 2. It was the coolest game of our lives at that age. I think I was 16, maybe 15, 16 when it came out. But I'd play that game. And keep in mind, I would be 6 weeks out with an injury, and I'd play that game. And I would actually improve my lap times because I was visualizing. I was seeing myself do the movements. I would actually take the controller and do this with it, move it back and forth as I was jumping. I would envision myself what's called seat hopping or scrubbing a jump. I would envision myself going through a corner and riding through it perfectly through a rut. I would envision myself passing people, right? But visualization is so critical. I love that story you tell, because if we can see ourselves healing, it actually tells our body to heal quicker. This is not a woo-woo technique. This is purely how life works. This is what one of the top professional athlete skills is, to visualize yourself with the gold medal. Visualize yourself dominating the field. You've seen professional athletes do that. They get in the zone. And that's really so important in the rehab process.
And I would also, one of the other things kind of in with, I guess in the same regard as mindset, is them understanding how fear impacts their recovery and how stress impacts their recovery. So I do feel all these things are they're variables that affect your mindset. And so if you're overly stressed about things outside of your physical recovery or your health, that does affect it in the long run. Or if
Why does that? What is the physiological effect of stress? What does that do to the body?
Increased cortisol levels. Cortisol results in increased inflammation. Inflammation presents actual good blood flow from getting to an area and making it so it doesn't really heal as quick.
Yeah. And there another factor to add on to that. It actually breaks down tissue. Right? Like it
degrades it.
So, you think about how detrimental cortisol is to the healing process. It actually almost reverses the healing process.
Yeah.
So you want your body to regenerate, but all of a sudden, like what Brent's talking about here,
stresses.
You got a high level of stress. You want that knee to heal quickly. It's not happening.
Nope.
It's really limiting blood flow to and oxygen and all the good nutrients to that healing tissue.
Yeah. Yeah. And then
What was the second factor you talked about? So you talked about stress.
Fear. So
Tell us about fear.
We see a lot of, there's actually a questionnaire that we give out to some of our patients, the FABQ, Fear Avoidant Behavior Questionnaire, right? And the thing that's interesting about that one is like, okay, some people with back pain, they may have the same MRI as someone else, or they may have the same imaging, they may have similar symptoms, and in a couple weeks, one person can still hardly move, and the other one is out there walking and thriving.
Dude, we got to dive deep into this. This is good stuff. Keep going.
Oh no. But I think part of it is, again, what is your are you really that afraid of moving, or are you afraid of re-injuring? Because I think that's one of the things is a lot of people think if they bend down to do this or do that, then they're going to re-injure their back, or their back's going to go out of place, or they're going to throw out their back, however you want to say it. And so what do? They stop doing it. They stop bending. They stop doing the things they want to do.
Let's just abolish those things that we hear. Number one, what is throwing out your back?
It's a very scientific term.
What is the
I don't know.
What does the patients really typically think throwing out your back is, and what is what's happening?
With that one in particular, when people say that they think they threw out their back, I feel like sometimes they imagine almost like their spine is just totally separating. At least sometimes when people explain what they're feeling, they're like, oh my gosh, it just totally went out. And if we look at the spine, it is a sturdy structure. To throw it out, I mean, maybe a car accident, that might get us to throw out our back.
And throw out, in my mind and in someone else's mind, might be a completely different thing,
exactly.
Right? Because the way I've had patients describe it is very similar to yours. It's literally like my disc just exploded, right? And it's gone. It's like a jelly donut that just splurted out, or a pimple it exploded and pushed into all these structures, right? Or they imagine bones just separating from each other,
shifting.
right? And shifting. But as we know scientifically, that actually is the furthest thing from the truth.
Yeah.
Tell us more.
Well, I was actually going to ask you, do you remember, because again, I couldn't do it with them surgery. I don't think I could sit down on surgery, but you sat in on a disc replacement.
Yeah.
And you actually got to see what they do, see all the structure and everything in there, and actually feel in a sense what it's like.
I've sat in a lot of surgeries and disc replacements, microdiscectomies, which part of the disc is being removed. I've sat in fusions and multiple other surgeries, but since we're talking about the spine is ridiculously resilient. And even in anatomy, we had human anatomy where we had 8 different bodies. Yeah. And they were all deceased, obviously, and we dissected them. And just like you did with the frog in biology back in junior high or high school. And our job, we got down to the spine, and we took out one of the discs, and we cut out part of the spine. We wanted to feel the integrity of the disc. And I remember throwing a disc on a table, and it was so thick and so hard, and that the outside of the disc is in Latin, in English is called tough mother. Yeah. It's dura mater, right? And that outer structure is so strong. I remember stabbing it with a scalpel, and I couldn't even get through it. It was so strong.
Yeah.
Now, if you do have a herniated disc, sometimes a herniated disc can actually push through certain structures. There's one called the axilla at the L4, L5 region. And if it gets pushed through these 2 structures, it really gets pinched. Yeah. And that pinch kind of keeps part of the disc. which is very similar to crab meat. It's really interesting. When you pull on it, it's really strong, but it feels like crab meat as you roll it through your fingers. And that's when the inner part of your disc actually pushes through that dura mater, that tough outer edge. And it takes a lot to do that. So when people say they threw out their back, that's actually scientifically what could be happening. It doesn't mean it is happening, because sometimes you have what's called the chemical leakage. When you're compressing a disc for a long period of time, it leaks a chemical as kind of a prerequisite to actually a herniation. And that is very toxic to the nerve. And then those nerves get really irritated and send signals, right? But when people say throw out their back, it's typically a toxicity thing that it's leaking out, or it could be that you had a disc push that inner structure outwards. But the majority of the time, if you talk to any surgeon, that absorbs back into the disc. When it doesn't is when it gets trapped between multiple structures. But going back to this fear avoidant thing, what is the danger of being fearful of moving?
I feel like it puts you into this like downward spiral where you get to the point of you're thinking, if I do this, it's going to hurt. So I don't do this. And then your body starts saying, oh, well, if I can't do this, then I can't do this other thing. And so then we get to the point where now I can't bend forward. I can't squat down. I can't do this because my brain has this idea that everything's going to hurt. Everything I do is going to hurt. And so then we get more and more fear avoidant. We decide to not do anything. And then by then it's a little bit tough to get back. And that's where we have to come in.
Get
back
absolutely.
to where they want to be.
And what you focus on expands. Right?
Love it.
How have you seen that with your patients with this topic? You're thinking about like, I can't do this, I can't do that, right? If we were to take this concept, have you seen that happen with patients?
Oh yeah, 100%. They start like sometimes we'll refer to as like catastrophizing, or again they just get to the point where they can't see themselves getting out of this rut that they're in because they're so far into it. And so it's where, again, mindset, if we can change their mindset, if we can help them understand that, hey, motion is lotion. We got to get things moving, and that's going to help get things feeling better. So it's kind of up to, us and other healthcare professionals helping them along the way understand that, we're not really going to be doing further damage. We're actually going to be helping those tissues and actually helping them heal so they can get back to doing all the things that they really enjoy doing.
Yeah. I have a scenario that I ran into this morning. I'd love to hear your thoughts on how you'd respond to this. I saw a Facebook post on like one of the community pages about anyone having a back brace. My daughter, this was a mom that said, my daughter has a ton of back pain right now, and I need a back brace for her. Anyone in the community have one? I'll talk to you about how I responded, but I'd love to hear how Brent would respond in this topic of fear avoidance.
I think with braces, there's a time and a place. Sometimes you'll need some for that extra little bit of support, but in the long run, like what you really want is to actually develop the muscles, get them stronger so that they can actually support and handle everything that you're going to be doing. So I would say, with at least in that regard, what I would hope that you said is, hey, let's see if we can actually get you moving. Let's see if we can actually get those tissues a little bit stronger. So, but I think if like you're just jumping to a brace, then you start actually relying on the brace as like a crutch. And then we start getting into that again. Well, now I'm stuck in this position, so I can't bend this way or that way because it hurts. And then we keep going, we get down that downward spiral again.
When we brace people early on, what we call the acute phase, what does that do to people's recovery? Like say this teenage girl, we'd throw on her back brace for 3 weeks. What does that do to her recovery? I'm talking about timelines.
Yeah, I feel like it halts it because we're not getting the good blood flow to those areas. We're not getting the motion through those areas that we would normally hope for.
And Brent's kind here. He says, I feel like it does. It actually does, people. Like, you brace something like that, it freaking will mess up your recovery. You could have that teenager back to full return to sport in 3 weeks.
Yeah.
You know, and you put them in a brace, it creates fear avoidance, which means people get fearful of moving because you're literally bracing them and saying, don't move, right? You're thinking that's healing the process, but it's literally not doing that. It's doing the very opposite. It's creating this fear avoidant behavior, stating to the mind that you are fragile and you're going to break. Therefore, we're going to have to put you in this giant brace, when the best thing you could do would be gentle movements, modifications, right? So I responded to this gal and I said, you know, the clinical practice guidelines state that we don't brace acute low back injuries anymore. We used to do that in the past. We've realized that delays healing process. The best thing you could do right now is gradual movement, modify your activity, and get your freaking butt into a PT office, right?
Come see us.
Message me if you need anything. You know what I mean? Like, that's how I responded to her. But we really need to change societal's viewpoint of, like, what this really means. And as PTs fully own that. Like, we know that it delays healing. Like, we got to get people to that level to where they can see that as well. Talk to us about what happens when you do brace. What happens to blood flow? What happens to that lubrication? What happens to getting nutrients? Like, talk to me about that.
There was another study, like, they did it they immobilized like a rat's ankle essentially, and all they did was just put a cast on it, and they found that within, like, and again with the rat's lifespan, it's a little bit different compared to what we as humans experience, but they developed tendinitis or tendinopathies in that immobilized tissue within a day. It was something that just happens that fast. So if we think of, like, again, like if you're bracing for a prolonged period, you're not allowing those tissues to move the way that they're normally meant to move. Our body's meant to move. Our body's, like, incredibly resilient and it's incredibly adaptable. And so if we just stick a brace on and we just hold it in this place where we can't move, we're not really getting those muscles to actually do their job.
Yeah.
And so then other things start getting affected. We could look at some of the joint spaces. We could look at some other soft tissues I feel like are going to get halted, or they're not going to get the adequate blood flow that they need. And then like I said, we're going to get to that point where we start developing more of that fear avoidant behavior that you're talking about.
Yeah.
And we just get stuck in a rut.
Yeah, and I love the way that you explain that. Well said. One of the things that I like to explain to patients with blood flow is that blood flow is nutrients. It's like food to your injured tissue. And you have this thing called a muscle pump, right? When we squeeze our muscles, it actually pumps more blood and nutrients to the tissue, so more of that food. And then it also pumps more blood out of the damaged tissue that the body, the macrophages, are actually breaking down to actually repair. Right? So if you're not moving, you're not actually getting the food to the actual tissue, and you're not getting the damaged tissue that's going out. And there's just so much that's happening with mindset. There's so much what's happening with actual tissue healing. Why do we say, as far as when we're talking synovial fluid with joints, why do we say motion is lotion?
Part of that is the synovial fluid is actually what helps keep those joints healthy, hydrated, helps push out some of those nutrients to, like, the end ranges of the joint capsule. So a lot of times I think of, like, with knees, we hear about knee osteoarthritis all the time. We hear about, or like hip osteoarthritis, or some of these things where it's essentially what's happening is the outer rims of that disc have dried up. They start getting what they call like these crystallizations start forming, and then calcifications start building up on that. And that's where we also actually start to see some of these bony growths on the outer rims of that joint. And so if we're not getting that synovial fluid to the outer rims of that joint.
Tell us about what synovial fluid is.
Basically, it's a fluid that sits in, like, it's essentially this fluid that's in all of your joints, or in all these joint spaces. And its essentially main purpose is to help keep it lubricated, help keep it healthy, and help push nutrients into the cartilage that's in that joint. And keep in mind,
greater than 90% of the joints in your body, a joint is where two bones come together, and then there's a hinge point, or they move around those pivot points. And 90%, greater than 90% of your joints in your body are synovial joints. Synovial joints have synovial fluid. Think of that synovial fluid like a little WD-40 or oil.
It's the grease.
You get the grease that's happening. The most important thing that you need to understand about this is synovial joints are only self-lubricated.
Yeah.
So you only get them lubricated through movement.
You can't
right?
inject it.
I mean, you get that synthetic crap, but if you handled synovial fluid, which I'm not sure if you have.
I have not.
In anatomy, we actually had synovial fluid, and I felt it. And I felt a lot of transmission oil and engine oil in my life. I know what all those lubricants feel like. There is nothing like synovial fluid. It is the viscosity of it is so hard to explain. It is so smooth and such a good material. We can't even replicate it synthetically. And we have these hyaluronic acid shots that we do in different joints, which is like a synthetic lubricant. But the body produces it on its own, right? But it produces it based on how you move. Yeah. And if you're not moving a joint, that's what Brent really just summarized for us with the calcifications that happen, the bony growth that happens, right? Because synovial fluid is a lubricant to the joint. It lubricates it, so it keeps it nice and smooth and rolling. But when you don't move it, all of a sudden the body says, well, we don't need this joint anymore. Yeah. Starts to get calcium buildup in there. Starts to get all crunchy. Starts to get all these little bony nodules, right? And then all of a sudden your knee hurts like crazy. What you can do to reverse that, or essentially help out with that, get it the nutrients.
Get it moving.
You modify the movement. I'm not saying move in pain ranges, right? Let's move in pain-free ranges. There's a lot we can do here. Yeah. But literally the number one practice guideline for knee osteoarthritis is what, Brent?
Movement.
Movement. Before anything else. Literally, it's like across all professions. Yeah. Like the number one clinical practice guideline for bone-on-bone knee pain is movement. But that doesn't mean go walk. That doesn't mean go do stairs. It means figure out what activity you can do in pain-free ranges to get it the nutrients that it needs. Because you got blood flow that gets those nutrients in and out, but then you got synovial fluid that actually lubricates the joint to make it feel better. Yeah. So what other thoughts come to mind as we're talking about two people, same injury, totally different speed of getting to the end result? Any other big concepts? And then we'll talk about the hidden ones. Yeah. We don't talk about as much.
The other one, because I know, so mindset, like we said, is huge. I also think like a big, I shouldn't say I think. The big one too is, are they getting adequate sleep? Sleep is when we actually
This is definitely one of those hidden ones. Tell us about sleep, Brent.
So just to specify, there is a difference between resting, like we were talking about, like sometimes you'll hear, maybe I should just let this rest, or maybe I should just hold off on doing.
Freaking hate that word, because there's too much variation in rest.
Yes.
Like if we're gonna prescribe rest, we got to be very clear on what rest actually is. You know what I mean? But yeah, you're right. What's the difference between rest and sleep?
Sleep. You want the 6 to 8 hours. Again, everyone's going to be a little bit different. I feel like pro athletes sometimes are hitting 8 to 10 hours, some even more than that.
Yeah, the new recommendation is 8 to 9 hours, which is definitely changed in the sleep world. Yeah. But yeah, if you're not getting at least 7 hours of sleep, that's kind of the minimum standard now. Tell us what happens through the sleep cycle in healing.
So there's different cycles. So you got the REM cycle that most people have heard of, the rapid eye movement cycle, and that's going to be where
it's where I start twitching.
You start.
I'm just kidding.
I start going back and forth. Those are the little dreams where you fall. Those kind of things, right? So, but during that's actually where your brain has the chance to go throughout your day and store memory, right? That's when it goes through and it starts like taking some of the things we learned from whatever that day, and then we can instill it into our long-term memory and we can recall it later. But there's also like deep sleep, and that's when we start getting a little bit more of the actual recovery that needs to happen in the muscle tissues. Or essentially the way I think about it is like your brain goes through this scan of your body, and it starts looking inward and trying to figure out, okay, what's going on? Am I like, where do we need to like heal, or what's going on in this area? Oh, we got an injury with this thing, or we had a surgery here. Let's see if we can actually start sending some healing factors down into that area and get it better. And so if we're not getting into those different phases of the sleep cycle, you're missing out on like some of the most important aspects of your recovery.
Yeah. I've learned through research studies and just clinical practice that 80 to 90% of recovery is two things.
Oh no.
What you eat and what you sleep, right? Like, we're all addicted to these saunas, which all play a role, right?
Well,
and these
they're
massage
fun.
guns
I like
and these
'em.
compression devices and, all these extra things.
Mm-hmm.
But we miss, really, the two most important components. I see this guy at the, I go to a sauna place. I think we both go to the same one.
Yeah.
I see this guy in there all the time. He has a full unlimited pass, and he just makes me giggle a little bit. But he was sitting there talking to me. He's like, I come here every day for 2 hours. Every day. I don't miss.
How does he have that much time?
That's
I
what
don't
I was
have that
thinking
much.
right now.
What the? Oh my gosh.
But I started asking him, like, how much you sleep in a day? 4 to 5 hours. And he was telling me all about his diet, too. And I'm like, huh. So what you're trying to do is take 80, 90% of recovery and say this is sauna, when I could get 80 to 90% of recovery just from sleep and nutrition, right? We try to Band-Aid it with these extra things, but what if he just took those 2 hours and just slept,
Yeah.
But he was talking about how so important saunas were for his recovery, but he was missing the foundational components to actually recover.
Yeah.
Right, that sleep and the way we eat.
Oh, yeah.
But sometimes it's hard to teach people that.
Yeah.
It wasn't my role in that moment. I just smiled and nodded.
You weren't working at that time. You got this is your R&R time.
Yeah, I was just trying to relax, and he was just imposing upon me.
Well, and there was another thing I just barely read about, like protein intake and diet. So the thing is, I get so lost with some of the pyramid, the reverse pyramid, the paleo, the keto. We keep getting in all these fads and these diets. And one of the biggest things, that, in all honesty, is just making sure that you're getting adequate protein intake.
Tell us about protein and healing.
Oh, man. I mean, that's one of the main things that helps actually stimulate your body to heal. So because we need to have that protein actually get some of those healing factors that are so crucial to the healing process. So if you're not getting enough, like think of like our post-op patients, some that have had like a total knee. If only like we'd have a nutritionist or someone after that would say, hey, you need to actually get so much more protein in your diet during these next couple weeks. Like I think that would make a world of a difference.
Yeah, something that we are working on in our clinical practice is making sure our physical therapists understand the importance of volume of intake with protein during the rehab process. Because if we as primary care physical therapists aren't having the discussion about adequate protein intake, we don't even know where people are. We're not really doing our job. If we don't know how much they're sleeping, if we don't know how much protein they're eating, if we don't know their activity levels and their goals, what you called that emotional button, what's important to them, we're really not acting as a primary care role. And people need to know what their protein levels need to be. So is what we do with our patients is we help them do a diary, which essentially you track all your food for the day. I want to know how much protein you're getting. Most people that say like, I eat a ton of protein. What do you see, Brad? Is that true?
So low.
Tell me about it.
I would even say, and I feel like I try to be fairly healthy, but I still feel like even like the things that I'm doing, I'm still below what the recommended dosage is or what I should be getting. I don't know if it's just, I feel like a part of it is it's so easy to eat something quick and easy.
Yeah, totally is. And, the biggest thing with protein, the general recommendation is 1 gram of protein per pound of body weight. So you weigh 150 pounds, and you'd be eating around 150 grams of protein if you're putting on muscle or if you're in the healing process. That's just been tried and true, one of the greatest tips for recovery and for healing. The reason for that is because protein is the building blocks of cells. Yeah. And if we don't get the basic foundational building blocks to rebuild and regenerate cells in our body, then we can't recover or heal well. Yeah. So what we do is we ramp up the protein intake, and goal is around 80% natural proteins, 20% supplemental. So if you're having a protein shake or a protein bar, Usually 2 different, maybe a
Different types of
protein shake and maybe a bar in the afternoon. But the majority is coming from whole proteins.
Yep.
But protein is huge.
Yeah.
Protein synthesis as we age, we know, slows down, right?
Decreasing.
So
Yep.
we need to increase protein intake even more, so that way the synthesis part, which just means the way to take protein, to break it down, to actually put it into your body, to actually rebuild tissue, is happening faster, is really important. So age does have a component with healing, for sure.
Yeah.
Anything else that comes to mind as far as recovery and just tips to be able to help people do it faster that doesn't delay them?
Yeah, I mean, I feel like we've talked about some of the big ones. Again, at the end of the day, some of the things that we do as physical therapists is just encourage our patients to move. And I know we've talked about like mindset, fear avoidant behavior, diet, sleep, but at the end of the day, movement. We got to make sure that we're getting people out and about in a way, like you mentioned, that's pain-free, that they're like, even if it's just doing something, that's better than nothing, right?
Yep, absolutely. Okay, well, I hope that gives you a lot of insight on things that you can actually physically do for yourself. We're going to dive into our rapid fire myth busting. A lot of people have misconceptions about this topic, and we want to really kind of abolish some of these. So our goal with these is to give Brent about 30 seconds, just rapid fire off the top of his head, how he can answer these questions to be able to abolish some of the mindset. Remember, 80% of healing is mindset, 20% mechanics. So if we can help abolish some of these myths, it can be really helpful to you. So first question, Brent, pain can linger after tissues have healed. It isn't always a damage report.
Yeah, that's true. I feel like so we talk about pain being almost like an alarm system. So, but sometimes that alarm system keeps going even if things are technically healed. So it's one of those things that, like, there could be something with the nerves. There's a lot of things that could be going on, but that's one of the things what we're trying to do as like physical therapists is we're trying to abolish pain and trying to get rid of that signal in hopes that we can get people moving better.
Yep.
Again.
So you can have pain even knowing
100%.
things have healed, and that's what we specialize in our profession, is getting you out of pain. Okay, next one. Habits and consistency predict recovery far better than age does. True or false?
True, 100%. I feel like age does have a role. We do start seeing some metabolic changes and other things like that, but consistency is key. We have one of our therapists here, Alex. He always talks about dialing it in and being consistent with your exercises, whether that's going for a walk or actually going to the gym, just being consistent about it.
I love it. Next one. Hurt and harm aren't the same. Safe movement is often the part of healing. True or false? Hurt and harm aren't the same.
True. Yeah. They're different. So like sometimes you might get sore. I feel like that's one of the things that we have to help people understand is that there's a difference between actual damage to a tissue versus like sore muscles.
Yeah.
Yeah.
What I've realized, this kind of blew my mind when I first got into practice, but a lot of people don't understand the difference between muscle soreness and actual pain.
Or even stretch.
Like
they're like, that hurts. It's like, well, is it stretching? Oh, yeah, that's a stretch.
Yeah, describe it to me. Well, it's just pulling on my muscle. Like, that is a stretch. Is there a sharp, stabby feeling that comes along? But yeah, no, we kind of make fun, point at it a little bit, but ultimately we're very sensitive in the clinic about this because sometimes they've never been taught what a stretch feels like or what muscle soreness feels like.
Yeah.
We call it delayed onset muscle soreness, where you work a muscle really hard and there's little micro tears. That's actually a good thing.
Yeah.
But a lot of people don't know what that means, which is very interesting to me. But at the same time, we're inundated by our own world. We went and got a doctoral degree to be able to understand these concepts. We got to remember that a lot of the general public doesn't understand those things. Yep. Next one, too much rest slows recovery. Guided movement speeds it up. True or false?
Guided movement speeds it up 100%.